Hello viewers, I welcome everyone for the interactive session. Myself Dr. Dayanand, DNB trainee, Department of Nephrology, Narayana Health Bengaluru. I welcome one of the senior consultant and transplant physician, Dr. Ishtiaque Ahmed, Department of Nephrology, Narayana Health Bengaluru. First of all, I would like to start with what are the common functions of kidney.
Kidney has a lot of functions in the body. Just to mention few important functions. One is filtration of blood. Second, maintenance of bony health, production of red blood cells, and secretion of multiple hormones which plays a role in various functions in the body. If you see filtration, what it does is it filters the blood, removes unwanted or toxic substances from the blood and discards in the urine. So blood is kept clean of unwanted substances. So this is one of the most important function of the kidney.
As we know, recently many people are suffering from kidney diseases. So we come across the term called chronic kidney disease. So I want to know what is chronic kidney disease.
When the kidney function is permanently damaged, we call it chronic kidney disease. There is something like a temporarily damaged kidney function that we call it acute kidney failure. But when the kidney function, the normal functions are not there and it is damaged permanently, we call it chronic kidney disease.
So nowadays, what are the most common causes of chronic kidney disease?
If you see, the most common causes are, one is diabetes. The second one is hypertension or blood pressure, which is there for longer time. The third cause is unwanted intake of nephrotoxic drugs, maybe painkillers or maybe some antibiotics. The fourth commonest cause is primary glomerular disease. But if you see, the most commonest cause of chronic kidney disease is diabetes. Anywhere in the world, if you see all the chronic kidney disease patients, roughly about 50% of all patients, chronic kidney disease is related to diabetes. The second commonest cause is hypertension, which is there for longer time. But there are a lot of other causes, maybe I will say rare causes like hereditary disorders, there are obstructive disorders. There are many causes, more than, I can say more than 30, 40 different causes. But the most common causes are diabetes, blood pressure, drugs, nephrotoxic drugs, and primary glomerular diseases.
Okay. So in people, how they will know that they are suffering from kidney disease? What are the symptoms they may have, or how do they present to us with kidney disease?
In the initial period of chronic kidney disease, there may not be any symptoms. Unless you do some blood tests or urine tests, you won't realize that patient has chronic kidney disease. The symptoms comes much later. When the damage is above 70%, then only the symptoms will come. But if you see the symptoms, the commonest symptoms are unexplained weakness. Patient who was fine, everything was okay, but suddenly starts saying that I'm feeling weak. So that is unexplained weakness. Leg swelling. Now, at the end of the day, the patient says that he gets some leg swelling, or facial puffiness, or decreased appetite. Patient says that I don't feel like eating. Other symptoms are exertional breathing difficulty. So it means whenever a patient walks for some distance, he finds it very difficult to walk because of breathing difficulty. So these are the few common symptoms of chronic kidney disease. But most important aspect here is we should remember in the early part of chronic kidney disease, patients are totally asymptomatic. Unless you do the blood test or urine test, you won't realize the patient or a person has a chronic kidney disease.
As you told, patients who have early CKD, they will be asymptomatic. Then how do we know that the patient has chronic kidney disease?
So this is very important question, because there are no symptoms. Only screening test like urine test or blood test will tell us the patient has chronic kidney disease. This is the reason we advise a regular screening test for high-risk patients, like patient who have a diabetes. maybe it is worth checking for a kidney disease, even though patients are asymptomatic. Go for maybe at least once a year, go for a kidney test, go for a simple urine test and blood test, see whether you have asymptomatic chronic kidney disease. Don't wait for symptoms, especially in a high risk group like diabetes, hypertension, or patient with family history of chronic kidney disease. It's better to go for a screening test at least once a year.
Okay. So once we find out that patient has chronic kidney disease, so what are the treatment options available for the patient so that they should be prime about the treatment options available for them?
In the early part of the chronic kidney disease, where the damage is less than 80%, what we do is normally we do diet modification and medications. In the early part, that means when the damage is lesser than 80%. But if the damage is more than 80%, then patient has to go for renal replacement therapy, that is either dialysis or transplantation. So if you take early part treatment, diet modification plays a major role. Most of the patients, we cut down red meat, we cut down salt intake, and sometimes we cut down the fluid intake also. So this is diet modification in the early part. And depending on the cause of chronic kidney disease, there are various drugs we use. That is once again only in the early part. But once the damage is above 80%, then patient has to go for either dialysis or transplantation.
Okay, once the damage is severe or patient has very end stage renal disease, as you told, renal replacement therapy in the form of dialysis or kidney transplantation are the option. So what do you mean by dialysis?
Dialysis, in a simple term, it says cleaning or cleansing of the blood. So normally kidney should remove all the unwanted substance from the blood and it has to come out. If this function is not there, then we have to do it artificially by machine. So that is dialysis. So in a simple term, dialysis is nothing but cleansing the blood, basically remove all unwanted substances from the blood and make sure that blood is kept in a good stage.
Okay. So are there any other modalities or different types of dialysis?
Yeah, there are two types of dialysis. One is hemodialysis. The other one is peritoneal dialysis. The hemodialysis is one which has to be done in the hospital where blood will be taken out of the body and it will get cleaned in the machine and it will go back to the patient. So one is hemodialysis, that is something which we do it at home, hospital. The other one is peritoneal dialysis. It is something which we can do at home. Peritoneal dialysis, initially we admit patient in the hospital. We have to do a small operation in the abdomen. After that, we train patient how to do the dialysis at home and continue dialysis at home. So that is peritoneal dialysis. So basically there are two types of dialysis. One is hemodialysis, other one is peritoneal dialysis.
Okay. In between these two, hemodialysis and peritoneal dialysis, which is a better option for any patient?
Yeah, there is nothing like hemodialysis or peritoneal dialysis is better than each other. So it all depends on the patient choice. If patient says that I don't want to go to hospital for dialysis, then we tell him, no, you go for a peritoneal dialysis. But there are few patients, they say that I don't want to do dialysis myself. No, I would like to go to hospital for dialysis. Such patients we advise hemodialysis. But if you really compare hemodialysis and peritoneal dialysis, the quality of life is same. Expenditure per month is also same between hemodialysis and peritoneal dialysis. The major factor here is the patient's choice. If patient says that I want to go for hemo, okay, go for hemo. If patient says no, I would like to do at home, go for a peritoneal dialysis. There are very few selective conditions where we tell patients, no, you can't go for hemodialysis, you go for a peritoneal dialysis. There are a few conditions where we tell patient, no, you can't go for a peritoneal dialysis, you have to go for a hemodialysis. But in generally, there is hardly any difference between hemodialysis and peritoneal dialysis.
Okay, after knowing about peritoneal dialysis and hemodialysis, as you told, there are treatment options like dialysis and renal transplantation. So I would like to know a few things about kidney transplantation as a treatment option for patients with CKD.
Yeah. See, whenever a patient goes to end-stage renal disease, there will be only two options for the patient, either to go for a lifelong dialysis or go for short-term dialysis and then go for a kidney transplant. If you ask me, between two types of dialysis, as I told you earlier, there is hardly any difference. Outcomes are same, expenditure is same. But if you ask me between dialysis and transplant, definitely I'd say transplant is a better option because the quality of life, lifespan, even the expenditure, if you see, is better with the transplantation than dialysis. See, if you take average lifespan for a hemodialysis or a peritoneal dialysis patient is about 6 to 8 years in our country. But if you take average lifespan for a kidney transplant patient is about 12 to 14 years. So there is definite advantage of lifespan. There is definite advantage on quality of life. The quality of life with the transplant is much better than that of hemodialysis or a peritoneal dialysis. And long-term expenditure also, it makes more sensible to go for a transplant than going for hemodialysis or peritoneal dialysis. Friends, just to conclude, I would like to say chronic kidney disease is a common problem. It is harmful. It can be preventable if we take adequate precautions. The commonest cause of chronic kidney disease is diabetes and hypertension. If we control diabetes and hypertension, we can reduce the risk of developing chronic kidney disease.
Thank you, sir. That was an amazing interactive session with you. So to conclude, I would like to give some take-home message that chronic kidney disease is a common condition in general public. So it accounts for about 10% of general population. The most common cause being diabetes. To prevent the kidney disease, regular screening is necessary, and there are treatment options available. So early diagnosis is very useful in the management of chronic kidney disease. Thank you.